Next, I'd like to talk about some of the complications associated with a lower lid blepharoplasty. Now, it's important to understand that many times we'll do a facelift, we'll do an upper lid bleph, a lower lid bleph, and coronal. And so I always tell patients you can do A, B, C, and D, B and D, A and D, none of the above, all of the above, and you can mix and match. But there are some unique characteristics and complications associated with lower lid blepharoplasty. In addition, you can have a corneal abrasion, you can have excessive tearing, you can have dry eyes. The one thing that you can see is excessive swelling in the fat pads of the lower eyelid. One of the common reasons people have a lower lid bleph is because they got the puffiness. And so what we do is we go in there and we take out conservatively as much fat as we can to minimize the puffiness. Now that fat can retain fluid, so there may be certain days even after the bleph where you may have a little bout of fullness or swelling, and usually this is transient, and once the excess fluid is eliminated, the swelling will go down. One of the more feared complications is that of a lower lid ectropion. Now, an ectropion is a pulling down of the eyelid, so it's important that if you have a lower lid bleph, that you have good tone to the lower eyelid and that the surgeon does not take out excessive amounts of skin. Now, sometimes people will have a temporary ectropion where the eyelid will come down as a result of excessive swelling, or a condition called chemosis, C-H-E-M-O-S-I-S, chemosis, which is a swelling of the white part or sclera of the eyelid. And generally this will resolve with time. But again, I tell my patients, imperatively keep your head up, keep ice on your eyes. And many times patients will say, what do I do? 15 minutes, 4 times a day. And I look at them with a smile on my face. I say, where are you going? So it's really important to keep your head up, keep the ice on your eyes as much as you can to minimize the effects of bruising and swelling.